Hi everybody, my name's Rob. I'm not a dementia specialist in any form or situation, but I am the voice that's here to tell you a couple of facts about dementia and about dealing with dementia and how knowledge that you gain is going to help you be a caregiver for a family member with dementia. And more importantly, some details you need to kind of take into account with the dealing of the dementia with family and friends, and how to create support, and for that matter, how to back up your caregiver if it's not yourself physically. Either way, here's a few tips, and I need to for you to take note, to share it with friends and family, so that over time you will get the best out of the support for your dementia patient. Now, whether it's a caregiver yourself, looking after a dementia patient can be really, really hectic. It's something you once you've started to live through it, time and again with interviews I've been doing with people, all of them express the shock as to the size, the massiveness of the situation that is kind of in their hands. And a lot of the people I've been interviewing have told me that they initially have done the caregiving, and towards the end of the disease they've had, or the situation, they've had the care taken over by professionals. Now, knowing more about the care of dementia patients and allowing family members to have the same information will go a long way to getting the best time with your dementia patient in their lives and yours. Okay, so one of the problems you have, and a short cutting line here, is as soon as family and friends realize there's dementia, they come along, they don't fully understand it, and they think it's a problem, and they stop visiting. That's the worst thing you can do to a person. Roundabout when they know what's going on, by the way. It's not like it's a complete alien thing for them. They understand they're getting these problems of memory loss and mood changes, etc. So when they then see friends running away from them, it's very, very hard for them. You need to have that support of family and friends. The personality changes and things, you can't stop that. Communication skills, unacceptable social behavior. If you knew that they're going to be doing some strange things and accept that it's going to happen and not make an issue of it when the time comes, it just makes it so much easier for everybody to kind of behave normally and give the care and support for that patient that you need to fully understand. I'm going to mention it again. I need to tell you now, it's not contagious. The more you tell family and friends how it works, what dementia is, what these stages are, what the potential problems will be with the patient, the more they will realize that their visiting and interaction and help and support is so vital for that person. Okay, do not let them be the just stay away altogether person. Helping out, it's what I'm referring to. So again, if you come to our website, there is a specialist. Ina Davis is the dementia specialist. You're welcome to interact with her. There will be places you can do that through the website. Equally though, there is a lot of information on the site that will show and help you work through the stages, work through individual situations, things like safety and that sort of thing that make it easier for you or the caretaker, the caregiver, to look after that dementia patient. Here's a couple of tips with dealing with them and the caregiver for that matter too, helping out. Firstly, the patient itself. The more you've taught family and friends about that dementia, the more family and friends will help you with the support, the easier the burden will be, that you're not left the only person doing the whatever it is, the hard work. Actual interaction, and again this will be more of this on the site, actual activities, tips on what to actually do, what sort of ways to draw out memories with the patient. Sit and talk about specific parties, specific family members. Do you remember the time where? Sharing that gives stimulation to the patient. At the same time, when memories are remembered, the joy is well worth it. Sharing their stories, listen to it. Do activities that there actually will be, if they're not there yet, activity projects. I've got no idea what to call them, but they're things that you'll have on the website, and simple stuff. Test things, sometimes almost like a real sort of a school exam, and others are just fun, puzzles and things like that. But if you set up a schedule and time and things, and especially with friends and family, the more you can share the load, the more there will often be somebody with them, and the more their lives will be good. Now, if you had a full-time caregiver and it's not you, the more you help them out, the less you reduce the less stress gets carried through onto your dementia patient. So you need to understand that spreading the load, helping out, allowing that they just get a cup of tea and a break for a while, a complete break for a few hours even, in fact, while you, perhaps the person doing the puzzles or the activities or sharing stories or sitting with a few family members for an hour, a cup of tea and, that kind of thing. So interacting and relieving the caregiver's issues is huge. Back to the not contagious. It amuses me as to how many people worry about that. So once you've done even the first 5 minutes of research into dementia, which is, again, something you're obviously doing, you need to realize that you need to, I suppose the words teach, you need to make other people understand, without lecturing them, exactly what's entailed in the whole dementia, not contagious, what it does and what sort of things that come with it. So learning to deal with dementia and understanding behavior is everything.